Good afternoon. I've today left hospital after a week in which the NHS has saved my life, no question. It's hard to find words to express my debt, but before I come to that, I want to thank everyone in the entire UK for the effort and the sacrifice you have made and are making. When the sun is out and the kids are at home, when the whole natural world seems at its loveliest and the outdoors is so inviting, I can only imagine how tough it has been to follow the rules on social distancing. I thank you because so many millions and millions of people across this country have been doing the right thing. Millions going through the hardship of self-isolation, faithfully, patiently, and with thought and care for others as well as for themselves. I want you to know that this Easter Sunday, I do believe that your efforts are worth it and are daily proving their worth. Because although we mourn every day those who are taken from us in such numbers, and though the struggle is by no means over, we are now making progress in this incredible national battle against coronavirus. A fight we never picked against an enemy we still don't entirely understand. We're making progress in this national battle because the British public formed a human shield around this country's greatest national asset, our National Health Service. We understood and we decided that if together we could keep our NHS safe, if we could stop our NHS from being overwhelmed, then we could not be beaten, and this country would rise together and overcome this challenge as we have overcome so many challenges in the past. In the last 7 days, I have, of course, seen the pressure that the NHS is under. I've seen the personal courage, not just of the doctors and nurses, but of everyone, the cleaners, the cooks, the healthcare workers of every description, physios, radiographers, pharmacists, who have kept coming to work, kept putting themselves in harm's way, kept risking this deadly virus. It is thanks to that courage, that devotion, that duty, and that love that our NHS has been unbeatable.
British Prime Minister Boris Johnson has been discharged from hospital after being treated for COVID-19. Johnson was admitted a week ago and spent 3 days in intensive care. His release from St Thomas's Hospital in London comes as the UK death toll from coronavirus tops 10,000, one of the highest in the world. Johnson's government has come under fire over a lack of personal protective equipment for frontline workers in hospitals. Well, for more, I'm joined by Charlotte Potts in London. Charlotte, PM Boris Johnson has now been discharged from hospital. What more do we know?
Well, the Prime Minister has left to the Prime Minister's country estate, Chequers, to continue his recovery there. And it's certainly been a wake-up call for Boris Johnson and for the country. For the British people, it showed that the virus doesn't discriminate, that it doesn't stop at Downing Street. And for Boris Johnson, well, he was very, let's say, careless in the beginning of the crisis and did not jump immediately to action. And now he has experienced what it means firsthand by spending a week at the hospital, and you mentioned three days in intensive care. Now, Downing Street saying his recovery might take a while. We're even hearing that he would not be back in charge for several weeks.
And the UK death toll, meanwhile, has now topped 10,000, with the government facing pretty intense criticism over its handling of the crisis. Is there the feeling in the UK that some of those deaths were indeed preventable?
Yes, for sure. Over the weekend, we saw the highest daily death toll in Europe, over 900 deaths per day. And that number continues to rise. Doctors and nurses are saying they don't have enough protective gear to protect themselves. 1 in 3 surgeons even saying that they can't operate because they don't have that proper gear. At the same time, doctors and nurses are dying. Nearly 20 NHS staff so far have died. And there is also a serious lack of testing. Only only the very severe cases at the moment are tested at the hospital. So there is no tracking virtually happening, and the unrecorded number of cases of coronavirus here in the UK is incredibly high. And this all as the peak is about to be reached. So really a crisis that could have been prepared for much earlier.
Reporting from London, Charlotte Potts, thank you. Now let's get you caught up to date on the coronavirus. And the Commissioner of the US Food and Drug Administration says his country is very close to the peak of its coronavirus case load. He is hopeful that restrictions can be eased by the 1st of May. In Spain, the number of deaths rose in the past 24 hours by more than 100 to 619, but new infections declined during the same period. South Korea reported 32 additional cases in the past day, continuing a downward trend in infections there. And Russia, meanwhile, has confirmed more than 2,000 new cases, its biggest daily increase since the outbreak began.